Let's return to Up to Date with KCUR's Steve Grasky.
And welcome back. When we talk about maternal health, the numbers are sobering. The United States has one of the highest maternal mortality rates of any wealthy country. And here in Missouri, the rates are among the worst in the entire country. Now I'm joined by Dr. Anna Grodzinski, a Kansas City cardiologist at St. Luke's Mid-America Heart Institute, who studies maternal health and has also navigated her own high-risk pregnancies. We'll talk about why pregnant people in Missouri are at such high risk and what's being done to change that. Dr. Grodzinski, so good to have you back. Welcome.
Thank you, Steve. Good to be back.
As I mentioned, Missouri, one of the worst states in the country when it comes to maternal deaths. From your perspective, why are pregnant people here struggling more than in other places?
I think it's a great question. It's a multi-rooted question where there are a number of factors that influence those outcomes. And so really when we think about maternal and baby health, we think about prevention and health pre-pregnancy and preconception that really influences those outcomes. So difficulty in accessing preventive health, both from a geographic perspective, transportation barriers, larger representation of rural communities, insurance access issues, all those really can drive outcomes. But also we know that now other factors, cardiovascular conditions during pregnancy, congenital heart conditions, where we know now that more adults are living with congenital heart disease than our children. And many of those women are desiring pregnancy. Those and other genetic factors and so forth can really influence those outcomes.
But women in other states have those conditions. Women in other states live in rural parts of those states, and yet the rates aren't as bad in those states. Do we know any more about why that is?
Yes, well, in Missouri, we do have an unusually high proportion of what we call maternity care deserts, where difficulty with access and a greater than 30-minute drive to a birthing center really can influence some of those outcomes. Other issues, degree of underinsurance or lack of insurance or fragmented insurance, and fragmented care as well in Missouri does influence those outcomes, where you're right, we are the sixth highest maternal mortality state in our country.
Do we need more hospitals and clinics in the Kansas City area and in Missouri? Would that help sort of close those gaps you're talking about?
It certainly may. It's a bit difficult to say because we've been on this trajectory now for over a decade. Certainly access to care, whether clinics or hospitals or both, would influence that. Again, what we're seeing is that higher or better access to preventive care, and often that's in a clinic-based setting, can really influence those outcomes. Whether that means access by telemedicine or other modalities, but that access would be key.
You mentioned, again, the one key here is that care before birth is so important. Is that what other states are doing better than what Missouri's doing?
That's certainly a proportion of the answer, or a contributor to the answer. We also know that there are conditions that are difficult to diagnose during pregnancy that can meaningfully impact adverse outcomes. One of those key drivers is a condition called cardiomyopathy, or low pump function of the heart around pregnancy. And when normal pregnancy symptoms include things like shortness of breath or fatigue, and also those are key presenting symptoms of cardiomyopathy, there can often be a delay to diagnosis. And again, when there's difficulty with access to providers, those are diagnosed later and maybe not at all. And so other states do have simply better access to care. That's a huge driver, but some of the answers we just don't have yet. And so we are contributing to several different research networks where we're hopeful that will improve access, enhance patients during pregnancy willingness to contribute to research, to help us determine how to better care
So
for them.
bottom line, what is the leading cause of death related to pregnancy then?
So nationally, cardiovascular conditions remain the key driver of adverse outcomes. In Missouri, just recently, mental health conditions superseded cardiovascular conditions. But both.
What do you mean mental health conditions?
Substance use disorders and things like anxiety and depression and other conditions that can lead to mental health causes of maternal death. Anxiety
and depression, are those rising as concerns in other states as well?
They are, and again, with increased access to mental health care, just like increased access to preventive health care and cardiovascular care, we know that we could mitigate some of those adverse outcomes.
This was interesting to me. I saw that the most recent report, it covered the years 2018 to 2022. It stated that the percent of preventable deaths was 80%. 80%. What is happening in these cases? Is it a failure of our medical system, or what do you think?
I think additional research is really needed there, and there has been increasing calls and recognition of cardiovascular conditions during pregnancy. However, it's true, the CDC over and over again, as well as in Missouri, our state maternal mortality review boards have determined that many of these outcomes are preventable. And so, again, likely multi-rooted, many of those likely being related to under access to preventive care or maternity care or late prenatal care.
We've been talking about the importance of care prior to birth, but some of these preventable deaths occur in the months after birth. What's happening those first few months like for someone who has this new baby? What are they struggling with?
Yes, we've become increasingly aware of issues arising in that fourth trimester or the first several months and up to a year after delivery, where we know that huge volume shifts after delivery, as well as the ongoing hormonal changes, can influence things like heart failure or weakening of the heart muscle, coronary changes and rhythm changes that we know are in part at least arising as a function of that hormonal and volume milieu changing.
You know, you're speaking about this as a doctor, but you have personal experience with your own high-risk pregnancies. What did that teach you, and how did it change the way that you care for other women?
I think just when you experience care on the patient side, I think that your degree of empathy really is influenced.
I can imagine.
And we were incredibly fortunate to have wonderful care with our pregnancy and with the delivery of our second son as well, now doing great. But I think that my awareness of the needs both within diabetes care, which was my own issue, as well as cardiovascular care, thanks to the insights of my providers at that time now 13 years ago, really influenced my interest in this space.
There are lots of disparities between race and level of education in the rate of mortality that we're talking about here. From your experience, why do you think it is that some pregnant people fare better than other pregnant people?
I think it's multi-factor. I think that so many of those outcomes are driven by access to care and providers and empathetic providers who are sensitive to particular symptoms during pregnancy. Again, those symptoms can be nuanced and difficult to incorporate or to flag a concern during pregnancy with regard to cardiovascular symptoms. When you have multidisciplinary care from providers who have a perspective in obstetrics as well as cardiology, we are sort of primed, or we're conditioned to be extra sensitive or aware of those types of symptoms changing. So I think that access to multidisciplinary care is a huge driver.
And for folks in rural parts of Missouri, I imagine finding that type of care is difficult.
It is more difficult, yes.
What do you think about how our society, especially here in Kansas City, winds up treating pregnant people and new parents?
I think it really is probably community-based and individual to each community. There are certainly programs that are sponsored at the national, at the regional, at the community level that work to enhance maternal child care. We know that in the postpartum period especially, that access to care is a problem because moms focus on baby. There's a very, very high rate of no-show rates to follow-up appointments in the postpartum period. We're aware of those things. And so touch points by phone, touch points by telemedicine, other access to their providers through the portal can sometimes help to improve that. We do have a ways to go for sure in supporting maternal child health, especially in the postpartum.
Give me some hope here as we wrap up this conversation. Are better days ahead when it comes to maternal mortality in Missouri?
We're optimistic about that, yes. And the contribution to important National Institutes of Health supported studies like the HOPE study led by my colleagues Dr. Florio, Dr. John Spurtis, and others, the peripartum cardiomyopathy networks, and as well as the screening networks, I think allow us to recognize symptoms and treat symptoms in patients at many stages in their pregnancy and postpartum journey. And so I am very hopeful and very optimistic that those research networks will offer better days.
Well, let's hope so. That's a good note to end on. That's the voice of Dr. Anna Grodzinski, a Kansas City cardiologist. She's at St. Luke's Mid-America Heart Institute. Dr. Grodzinski, so good to have you here again. Thanks for sharing all your good expertise.
Thank you, Steve.
You bet.